Hello, and thank you for joining us for the Pharmacy Cannabis Lecture Series. My name is Candace Hawes, and I want to thank all of our viewers and customers from Pharmacy Santa Ana, Santa Barbara, Berkeley, and the Pottery in LA for joining us today. Today, we have a wonderful presentation for you with our guest speaker, Dr. Seth Pheng. Working at a dispensary that serves a large number of new cannabis customers and medical users, I know that becoming a new cannabis consumer and patient can be a very overwhelming experience. So in today's webinar, we're going back to basics and talking about the different delivery methods and titration and how to find your right dose. We'll also discuss the positive and negative side effects to be aware of and the importance of keeping a cannabis journal. Like I mentioned earlier, I'm really excited to have our guest speaker today, Dr. Seth Pheng, with us. Dr. Pheng has a doctorate in pharmacy and is currently a practicing pharmacist with over 20 years experience in retail, hospital, clinical, and dispensary settings. Transitioning from a traditional retail pharmacy setting to a new medical dispensary, he recognized the need for more accurate dosing methods within the current cannabis products available. So with that, he co-founded Control Ltd. to create dosing products that will help new medical marijuana patients have access to accurate and reliable therapeutic doses. His goal is to standardize accurate dosing for all cannabis products. Control Ltd. is a medical device company formed to develop products and services addressing dosing problems of the cannabis industry. The main goal is to give users and providers the tools to maximize benefits of cannabis, whether medical or recreational. Control Ltd.'s philosophy has always been to provide everything the medical user needs to effectively dose cannabis. So I'm really excited to have Dr. Seth Pheng with us today. Thank you so much, Seth. How are you doing today?
Good. Thanks for having me again. I'm always feeling honored to be among the great panelists that you've had on previously. So thank you.
Yeah, definitely. And I can't wait to get in the information that we have today. Like I said, we service a lot of people entering into the cannabis market, people that have never used products before and trying to figure out what's the right thing for them and how much to use is something that is very overwhelming, can be kind of complex. And so I'm really excited to bring this back to basics. And I'm really looking forward to the information that you have for us.
Thank you. So, thanks for the great introduction again. So to become a better cannabis consumer, I guess you can say it starts from the beginning. Trying to figure that perfect dose or whatever it is at the beginning is pretty difficult. And I'm hoping some of the common issues and mistakes that I've seen from new cannabis users and consumers, I can shed some light on them and maybe help somebody along the way.
I think so, for sure.
So let's get started here. So we'll start with Mrs. Jackson. And you can sing along to the Miss Jackson song if you like. But Mrs. Jackson has been suffering from chronic pain for years. She's been trying to wean off her pain medication because of the side effects, and her pain isn't being controlled very well. So as a last resort, her doctor recommended that she get her medical card. So she went online, did some research, went to check out the dispensary she wants to visit, and just immediately overwhelmed with all the different products out there. And even the strain names really kind of throw her off as well. So she knows she's not comfortable buying flower to smoke, but she wants something like her prescription medications where she's used to taking something. So where should Mrs. Jackson start? Like we said, new cannabis users have a difficult time finding out how to start, often due to them looking at cannabis the same way as they look at their prescriptions. Tell me what to take, how often to take it, and send me on my way, right? So we all know this isn't the case when it comes to cannabis. Cannabis affects everyone differently, and oftentimes that journey can be a little bit difficult to manage, especially without any guidance. And at this stage too, especially with people like Mrs. Jackson, it's their last resort. So they're already frustrated. They're going over the same patterns that hinder their learning process. So they're already fed up. So being a patient is understandably hard. They're already frustrated. So we'll revisit Mrs. Jackson in a little bit and see if we can help her get started. So first off, being proactive, it will change. It's a game changer for your health, right? Working in a retail setting for over 20 years, I've seen so many patients come in and just take whatever their doctor gives them. No questions asked. Sometimes they don't even know what they're taking or what it's for, or even why they're taking it. So my goal for this webinar is to help consumers become more adaptable, more fluid, and more dynamic with their cannabis. Consumers need to adjust for their everyday needs, and that requires them to adjust their cannabis use as well. So whatever the consumer's intended effect is, whether it's pain relief or anxiety, different products and consumption methods will give different outcomes. So to become a better cannabis consumer, we're going to need to be able to answer these questions. Okay, so what products will work the best for me for my intended effect? It's a pretty obvious question, but if you don't know what products are out there, which most people don't, it's a difficult one to answer. What's going to best fit your lifestyle? What's going to best fit your lifestyle is not going to be the same for anybody else. So what's going to best fit you is a good question to ask. Also, what a good dose range is for the product. So oftentimes we talk about, hey, what's a good dose for this? I like to kind of shift that and say, what's a good dose range? Because we're not always going to be at that same pain scale or anxiety scale. We're always going to have to adjust. So we're going to need to know what that range is going to be. How fast does it start to work, and how long will it work? So those are some of the questions that we're going to have to kind of ask and figure out. And being a good cannabis consumer, you're going to need to know these. So first off, knowing the different methods of consumption and its attributes are going to help determine what best products is going to be best for your lifestyle. So consumers are going to need to learn how long you're going to have to wait for relief. So if you have something immediate, you want to know if it's going to work right away. How much you'll have to consume, what the dose is, and how often you have to dose throughout the day. So again, this is it's going to affect your lifestyle. One of the things I like to point out when I was in pharmacy school, one of our classes, we went over the benefits of cannabis and glaucoma eye pressure, right? So they were like, man, this is great. It reduces eye pressure. It's going to help people with glaucoma. But back in that time, the only thing available for most people was smoking a joint. So they figured out that to reduce the eye pressure the same amount as you would with prescription medications, you'd have to smoke a joint every hour or two to achieve that effect. So in the case for glaucoma, inhalation is pretty effective, but it wouldn't be a good lifestyle fit for most people, right? Because you're going to have to constantly be smoking to get that pressure relief. So I wanted to go over some of the pros and cons of the different consumption methods and kind of talk through them a little bit. So first off, inhalation. It's the fastest onset. It goes right into the lungs, goes directly into the bloodstream, so you're going to notice the effect pretty quickly. And again, just like in the case of the glaucoma, the effects don't last that long, maybe like an hour or two, and then you're going to have to redose. So it's good for titration, but not good for much anything else as far as finding your dose ranges. The dose of inhalation doesn't translate really well to, say, sublingual or oral dosing. So whatever you need as far as inhalation goes, it's going to be a little bit different than oral consumption or sublingual. Going into the next one, sublingual method, it's dosed under the tongue, and it absorbs into the bloodstream through the capillaries under the tongue. One of the benefits is that it bypasses the stomach and the liver, so you're going to get a little bit faster onset of action. And the dose increments that you'll see, they're adjustable. You're going to squeeze whatever amount you would like to use with the dropper, and it's up to your discretion. Another thing that is good with sublinguals or tinctures is that usually they're lower potency. So with that, you don't really have to worry too much about over medicating accidentally. So if you accidentally take too much, since it is the lower potency, you're not going to have to worry about that too much. And again, it is good to determine your oral dose. It does translate really well. So if you hit maybe 10 milligrams on sublingual, you're going to be about 10 milligrams on oral dosing as well for the most part. Absorption does vary with some of the sublinguals. So depending on their formulation, whether they're alcohol-based, oil-based, things like that, that's going to determine how fast it's going to absorb under the tongue. So typically with alcohol-based, it's a little bit faster than oil. So just some of the things that you have to be careful of. Next thing is the oral route. It has a longer onset of action, so meaning it takes a little bit longer to take effect. 45 minutes to an hour is on the minimum side. Sometimes it takes a little bit longer, and that depends a lot on what you take it with, how you take it, what time of the day as well too. So those are the things you kind of have to be cognizant of with oral dosing. Although the effects do last longer, about 4 to 8 hours for some people, maybe longer, or maybe some around 12 hours I've heard. But again, it's going to be all dependent on the dose and the user as well. So the doses come in a variety of increments. So if you need to titrate, it's if you can find the dose increments, titration is pretty easy to do. The next one is topical. Topical, you really don't have to titrate. You can just use it depending on the type of topical it is, whether it's creams, lotions, balms. It's going to determine how well it stays on the skin, how well it absorbs locally, things like that. And as well as the duration, it'll vary as well, just depending on how well it absorbs. Suppositories is a good point. Suppositories, I don't have it on here just because it's not as popular right now, but it is an effective route, especially when you're trying to, again, bypass the stomach. And for people that have nausea and things like that, it's a good route of administration, just because you're not getting into the stomach and having somebody have to throw it up if they're sick. So coming back to Mrs. Jackson, again, Mrs. Jackson has never tried cannabis before. She has moderate to severe arthritis in her joints from standing long hours at work. I think she's a pharmacy technician, so I don't know, maybe. Her pain is usually about a 1 out of 5 in the morning, but after work, it's maybe about a 3 or 4 out of 5 on most days. Mrs. Jackson doesn't want to inhale cannabis. She's willing to be patient and learn what will work for her and the best fit for her lifestyle. So she's already off to a good start to becoming a better cannabis consumer, because she's willing to learn and be patient. So what is a good option for Mrs. Jackson to start with? We have the capsules and tablets, tinctures, vape cartridges, and the topicals, creams, and lotions. If you guys want to put in the chat, what do you think? What do you think is a good option for her to start with?
I love how you're interactive.
I see tinctures. Good. So my recommendation, I would say all options are acceptable. Sublingual tinctures would be a really good choice for Mrs. Jackson, but oral would be okay as well. If she can find a smaller dose with tablets or capsules, and she can titrate up, that would be a good option. My choice would be sublinguals, just because it's a little bit faster onset and she can adjust her dose. And obviously inhalation is off the table, since she's currently not comfortable. Not to say she won't be in the future, but she's currently not comfortable with that. And topicals are a good option as well. So all the options are good, but my recommendation would be when you're first trying to find out what a good product is, or even the dose range of a product, my recommendation is just to use one product at a time. So if you have, say, 3 or 4 products that you're trying out, and something works, now you're gonna have to figure out, like, oh, what worked out of those 4 things. So when you're first starting out, again, just start with one, just to see how comfortable you are with it.
I completely agree. I have people come into the dispensary for the first time, and friends have told them about a couple different products, and they're really tempted to get like a couple things. And I was like, but you got to make sure that you go through one thing first. You try this, find out how it works before you move on to the next thing, because it can get confusing for people moving from like one product to the other before they've really figured out what their dose is and how all the delivery methods work.
Yeah, it's true. It's a good point. Whenever I talk to people and they're like, "Oh, I have all these products," I'm like, "How do you keep track?" And if you're a person that journals really well, which we'll go through in a little bit, and if you are, consistent with how you are, it might be okay. But typically, for most people, they're overwhelmed already. So it's a good thing to just keep it with one.
Yeah, start simple.
So Mrs. Jackson found a tincture she wanted to try with a 1-to-1 ratio of THC and CBD, and has about 10 milligrams per dropper full. So typically, tinctures, from what I see, you'd start with, they come in about 30 mLs. I do see some 15 ml ones, but typically you'll see 1 ounce or 30 ml vials or bottles of the tincture. So how much should Mrs. Jackson start with? There's dropper measurements. I know it seems kind of simple and kind of you think people would know, but the dropper markings are there and they're really good to a good reference point. So they come in 1/4 ml, 1/2 ml, 3/4, and 1 full ml. Again, if one of the things that I always have trouble with tinctures is when you squeeze up the dropper and there's like always air bubbles and things like that, and it's hard to kind of get that measurement. Typically you can just kind of shake those air bubbles out and see where it lands, but again, it's a nice tool to be able to kind of measure those out. So finding that comfortable dose range for typically what I would recommend in a dispensary setting is I always have people start with 1/4 to 1/2 dropper. You want to place the dropper under the tongue, let it sit there for at least a minute, and let it try to get it to absorb under your tongue. And if you do feel like you start building up any saliva, or you feel like you have to spit it out because it's just the saliva is building up, you can swallow what you have. That'll get processed in your stomach, in your gut too. So, but the main goal is to try to get it in there into your bloodstream, the quickest route, which would be under the tongue versus the stomach. So whatever you can handle, don't spit it out and you waste a dose. If you can handle swallowing your saliva, some of the saliva, it might feel like a lot, but it's only a little bit. The other recommendation would be, 1/4 of a dropper is probably like a really good increment, just because the volume underneath your tongue there, it's not a lot. So if you put maybe like a full dropper there, it's just going to be sitting there for a long time, and then you're really going to feel like you have spit in your mouth. So the less you can put in at a time, the better for absorption too.
Yeah, that's a good point. I was just going to add to that I have started to see now, there's not that many of them, but some brands are more concentrated. So it's always important to look at the concentration of the particular tincture, because some of them, they might say a dose is 1 whole, milliliter. Some might say a dose is 1/4 milliliter. So just, make sure you look at your product. But most of them are pretty standard, and like a good place to start, like you said, is about 1/4 dropper.
Yeah, thanks for that, Candice. Yeah, it's one of the difficulties is there are so many products out there, and I think one of the episodes you had somebody, it was a company, I'm blanking on the name now, but they had a faster acting, so water soluble nanotechnology tincture that would absorb very quickly. So in those cases, again, you have to be cognizant of what product you're taking. If it's going to work a lot faster than your other tinctures, again, documenting and knowing what you're taking is important. So once you take the dose, what do you do? So once you take the dose, you're going to wait the estimated time of onset. So roughly, if you're looking at sublinguals, again, it's going to vary, but you're going to wait, looked about 20 to 30 minutes for absorption time to feel some kind of effect. If it's oral medication, it's obviously going to be a little bit longer. So wait the estimated time. And once you do start feeling something, you're going to just assess 2 things. There's going to be more things you're going to assess, but initially, how am I getting the intended effect? So if your intended effect is pain relief, that's what you're looking for. So, if your pain scale was a 3 out of 5, you're kind of looking for something that's a little bit, hopefully a little bit less for that intended effect. Secondly, you're going to ask yourself, am I comfortable with the psychoactive effect that I'm getting, right? So again, when you're looking at the cannabis as a medicine, sometimes you're not really going to get away from the psychoactive effect, but it's not a bad thing. You're just going to have to, again, be cognizant of it and use that knowledge for future dosing. So here we have Mrs. Jackson again. She starts off with a half dropper, very courageous of her. So she noted that the effect started around 30 minutes after she dosed. She felt some moderate pain relief going from a 4 out of 5 to a 3 out of 5. And at a half a dropper, she felt a moderate psychoactive effect. And she also noted that it lasted her about 4 hours. The relief lasted her about 4 hours. And also noted that the psychoactive effect lasted only about 3 hours. So a little bit less time. And it's also a good thing to note that you want to really keep track of both things. Again, sometimes when people chase that psychoactive effect, they're not really, kind of paying attention to the actual effect that they're looking for, which would be maybe like pain relief or anxiety or whatever it is. And if they're chasing that psychoactive effect, they're not really going to get a good indicator of what they're actually using it for. Unless they are using it for the psychoactive effect, then that's what you're looking for. So next question is, should Mrs. Jackson continue to titrate up her dose? She knows that she can take a half a dropper or a half ml now, and she's comfortable with it. What do you think Mrs. Jackson should do? Should she keep titrating up to find her dose? Yes. And again, you can type in the chat too if you want to answer. Or not. So my recommendation would be to stay on her current dose for at least 5 doses. You want to kind of keep that dose and keep going with it, especially when you're trying to figure out, how it's affecting you. And you want to get a better sense of how it is. That first page of the journal, when you write these things down, it might be a little bit different, the 5th dose in or the 10th dose in. So you really want to get, and actually you want to get better data points, right? So when you're collecting, basically when you take the medicine and you're assessing yourself, you're collecting data points. And if you only have one data point to go off of, it's not really a good indicator. So again, my recommendation would be to stay on that dose for at least 5 doses, kind of get used to it, get accustomed to it. And once that she does feel comfortable, she can gradually increase. And we can use the flow chart, and I'll go over that in a little bit. And then after each increment, you're going to do the same thing. You're going to assess that comfortable dose, that dose again. So here is the workflow. Again, it looks like it's a lot, but let's go over what Mrs. Jackson did when she went through the workflow. So here we have Mrs. Jackson's incremented dose. So she already knows that she's good at a half dropper. So that's the start dose. And when you go through the flow chart, you're going to add that preferred incremented dose. So she wants to add a 1/4 dropper to her half dose, which right now it would total 3/4 dropper or 3/4 ml for the tincture. She's going to then wait the allotted time for the consumption method. So last time it took her about 30 minutes to feel the effect. And so she's going to wait about 30 minutes again. And then she's going to ask herself those questions. Am I getting the intended effect? So at 3/4 dropper, she got the intended effect. So her pain relief went from a 3 out of 5 to a 2 out of 5. The next question is, am I comfortable with the psychoactive effect? And at 3/4 of a dropper, she said no. She didn't like the way it made her feel. It was kind of high, a little bit too high for her. So what she would do is she would record that as reaching that intended effect. So she achieved the intended effect. It gave her pain relief, but with high psychoactive effect. So again, not to say that having that is a bad thing. It's just that now she knows that that's going to be on her upper limit of the dose for the tincture. So now that we have some more data points, we have that she is okay with the half a dropper or half an ml. And now she knows that 3/4 of a dropper may be a little bit too high for her. So she can kind of stay in between those lines, maybe even a little bit less. So if she wanted to titrate down and see what the minimum amount that she could take for some pain relief, she could do that as well. So then again, she would have that dose range. And the reason why, sticking to one dose is good, but I would recommend having a range of doses is, again, if she would say happen to have a pain of 5 out of 5 one day and she really needs that pain relief and she knows she's going to get it out of the higher dose, she can do that, but she's going to have to prepare herself that she's going to have a little bit more psychoactivity. So, maybe she's going to stay home that evening and not go anywhere or whatever. So again, you're going to be able to plan out your lifestyle. You're going to be able to plan out your day much better if you know how these doses and what ranges affect you. So again, just going over Mrs. Jackson's current progress. At a half dropper, she gets mild relief, 3/4 better pain relief, and then her duration and onset of action is listed there. And this is just kind of, again, something that she is going to keep track of, something that she'll know for the future. So here we have, I have an example of one of our journaling page that we have. You can download this, print it out. I mean, this is pretty much, it's pretty generic as far as like what you're looking for, but it's always good. You can always add to this. If there's any effects that you wanted to add or note, you can add there. It's not all inclusive where everything's there. So you'll want to keep track of the things that you think affect you, whether it's something that's not on the list or if it is the list. So this is a good kind of indicator on what to look for. And again, if you want to add anything to this, that's good as well.
And I love this. I love that you made this cannabis log, this journal, because I'm always telling people how important it is to journal their experiences until they find, what dose is good for them and figure out all the different delivery methods. And I really liked how simple this one is. So thank you for including that.
Thank you. So here is Mrs. Jackson's half a dropper journal. And you can see here she put in, she did a pretty good job. She put in, what the ingredients were or the lab results were for the product in there. So we have the THC and CBD. We also put in what the intended effect is. So you're going to rate, what the pain scale is before consumption, and then you can rate it afterwards to see if it actually helped. So when you do look back at these journals, you can say, oh, okay, well, it shifted from a 3 to a 2 or whatever it may be. Again, you can log in the onset of action, how long it takes to work. And then the other part is the intended effect, how long that works, as well as the psychoactivity. Those are all good points to keep track of, as well as some of the other kind of effects that you're looking for. And then another good one is the psychoactive effect you want to kind of log as well, again. Actually, one of the other good points about journaling is, I always use the example of when you go to a doctor and the doctor says, hey, I'm going to put you on new blood pressure medication and you're going to take this for a few weeks. And then when you come back, we'll reassess and we'll see how well you do. So it's going to be the same thing, right? You're going to find a medication, a cannabis product, you're going to start taking it. And then, when you go back to the doctor, they take your vitals, they take, your blood pressure, they ask you how, if there's any side effects that you didn't like about the medication. They ask, if they actually check to see if it improved or if it got worse. So these are the kinds of questions that you can ask yourself, right? These are the things that you know directly when you take this medication that it's how it's going to affect you. So it's the same way, you know, in the doctor's office, every time you visit them, they pull out a full file, and your file has all your prescriptions, all your health vitals, and all that stuff. And when you journal, it's kind of the same thing, right? You're going to have a little file of your own thing, your own personal journey, and it's going to have all your medical information in it. And it's always good to have. And it's just, like I said, it's pretty much the same thing. So again, you're becoming your own advocate. You're becoming your own health advocate in this case. So here is Mrs. Jackson's 3/4 dropper dose. So you can see some things changed. The tincture and everything stayed the same because she's using the same one, obviously. But some of the other things changed, like the intended effect lasted a little bit longer for her. The psychoactivity lasted a little bit longer as well, just because of the increased dose. But you can see that after consumption, it did drop more points on her pain scale. This is, like I said, these are things that she can kind of look up and take a look and keep track of.
And I think even for experienced consumers that it's nice to keep a cannabis journal, even kind of a neat skilled or habit to create, because if you try all sorts of different products, even like different sorts of cannabis flower, you know, and you use something you really like, you record how the effect was. And then like later on, you could be like, oh, remember that one, you know, strain that I really liked and it worked really well for me for nighttime. What was it? I can't remember. You can always flip back through your journal and you can find that product that worked really well for you. So I kind of like keeping a cannabis journal, even as someone who's a more, you know, a consumer that's been using for a while.
Yeah, it's true. The journal isn't just, you know, I always like to say, yeah, once you journal enough, you kind of get the sense of you know, what's good for you or what works for you. But you know, and as the industry is ever changing and more products come out, you know, you never know what's going to be new again. So new to you anyway. So it's always good to keep track, and especially with the new formulations, you know, new products, and like you said, it's always good to keep those in mind. So Mrs. Jackson did really well. She got on her phone and called her grandson and said, "Hey, this is really good stuff. My doctor was great in recommending the medical card." So her grandson Tyler, he sees the improvement that his grandmother did, so he wants to get his medical card as well. So Mrs. Jackson's grandson sees the improvement, and he wants to treat his anxiety and stress for his job. Tyler does have some experience with cannabis, but isn't familiar with anything other than smoking it. He does want to try tinctures and capsules and tablets, though. Oops, sorry. So what would be a good consumption method for Mrs. Jackson's grandson, Tyler? What do you guys
can put your comments in the chat.
I cheated and went to the next slide already, so. So we got some answers. Awesome. Vape edibles. Good. My recommendation would be, again, any option would be good for Tyler, but since he has experience with cannabis, he could titrate a little bit less conservatively than his grandmother, Mrs. Jackson, would. Oral capsules or tablets would be okay to start with, even tinctures as well. And I saw vape would be good. He can use that in between his longer acting doses to help with any kind of as needed issues. So another recommendation that I have for Tyler would be testing, especially with oral dosing with capsules and tablets, or even and edibles as well, is testing on a day that'll allow him to ride it out if he takes too much. So the psychoactive effect might be too much. So especially when, like I said, when you're using oral medication, when it lasts a lot longer, you want to be able to ride it out. If you you say I've smoked before, I'm good, and I hear this all the time. I smoke all the, I smoke a lot. I'm an avid smoker, and I can handle a little bit more. I'm more tolerant. But then when they take something oral, like an edible or something, it just rips them apart, and they're like, oh my gosh, So again, it's going to be a little bit different. So pick a day that you're going to be able to kind of ride it out if you need to. Sometimes maybe in the evening as well.
Mm-hmm.
So he starts out with 5 milligrams capsules in the morning with his toast. How long should Tyler wait to assess how he feels? 10 minutes, 30 minutes, 45 minutes to an hour, or 1 hour, and then every few hours until the effect wears off. What do you think? So my recommendation would be that it's good to keep track of when you first feel the effect, but also every few hours to assess the intensity and duration. So when you're looking at oral medication or oral dosing, the effects aren't going to be kind of like a straight line. You're going to have a point where you start feeling the effect, and then you're going to have a point when it feels most intense, and then you're going to have a point where it kind of starts weaning off. So those are the types of things you can kind of keep track of, and especially at the higher doses where you're going to hit that peak, and then you're going to be good afterwards. So again, it's something that you can kind of keep track of. So Tyler's 5 milligram capsule dose. So after about an hour and a half, Tyler feels a little psychoactive effect. He feels relaxed and mellow, a little dry mouth, but no other effects noted. So Tyler also noted that the psychoactive effect weaned off around 4 hours, with the intensity peaking at about 2 hours. The relaxation and mellowness lasted 5 hours straight through for him. So he did pretty well on this 5 milligram dose. The next question, should Tyler increase his dose to 2 5 milligram capsules for a total of 10 milligrams? Do it, Tyler. My recommendation, again, would be to take a few more doses, get comfortable with that current dose, and then he can increase. Unless he takes the 5 milligrams and just doesn't get any effect at all, or there's no anxiety relief, there's no psychoactive effect, he can probably up his dose. But again, just be careful, because we went from a 5 milligram to a 10 milligram, and that could be, people think it's not that much, but it could be. So again, he can stay at the current dose. I would recommend just a few more before he increases, but getting more of those data points on his journal page and things like that.
I love the capsules, but that's the same problem I find. It's like either the 5 or the 10 or the 20. There's no in between, and that's why the tinctures are so nice, because you really can, fluctuate and just titrate and add just a teeny bit more, a teeny bit more, a teeny bit less. It's not those larger jumps that you have to make. And also, capsules are a little bit more expensive, I find, as well.
Yeah. And I feel sometimes, depending on the type of capsule they use, when you do ingest it, it takes your stomach doesn't really break it down that well, so it doesn't get broken down, so it actually takes longer to take effect. It's just formulation, how they encapsulate it and things like that.
Yep.
And Bernadette is correct. It also depends on mood too. A lot of it is your environment, your space, and that's why it is important to kind of keep the same variables, the same dosing methods when you're first starting out, just to kind of keep all those variables out of play. Weed burp. Oh, weed burp. Yes, I get the weed burp. So we went through all these scenarios with Tyler and Mrs. Jackson, and I hope you came away with a little bit more information. But just to finish off, how to be a better cannabis consumer. I have just a few, stand on my soapbox and just have a few points. You'll want to be proactive. Again, being proactive with your health is really key in knowing yourself and knowing, being able to know cannabis a little bit better, and being able to introduce new products without having to worry of the effects that you're not wanting. Let go of the prescription mindset. Tell me what to take, tell me when to take it, and then just send me on my way. I've had a lot of customers come in, patients come in that, they're like, oh, well, I don't know anything. Just tell me. And it's again, you sit there and you're just like, sorry, it's not that simple. So let go of that prescription mindset, being able to be patient. Being patient I think should be number one in this one, but being patient is key, just because you have to be patient with yourself, because you're going to make mistakes. You're going to take a product, or you might take a few products that really don't fit you. In these scenarios, they all fit the people, just to make it easier. But some products, you take it and you're just like, wow, I do not like the way this feels. You're still going to journal it. You're still going to, keep track of it, but you're going to have to be patient, because it's a journey. It's not just, hey, here we go, I'm good. So the other part of that is being educated, so you have to constantly learn about the things. Being part of being proactive is educating yourself on what's going to work the best. And to be able to do that, you need to educate yourself. Again, journaling is important. One of the keys to this webinar, journaling, keeping track, like Candace said, is even as a veteran user, you're able to figure out, and this isn't just for cannabis. It's actually being able to journal is actually going to help you figure out your ailment, whatever it may be. For most people, if you ever talk to people that have, chronic pain, they're going to tell you, that has been in it. They're going to tell you everything that gives them pain, the weather, whatever they do, whatever they eat that day, or whatever it is. They're going to be able to tell you exactly how they feel, what the pain scale is, and things like that. So when you're able to track and figure out like what is causing certain things or what's helping, that's going to really help. Asking those questions when you go to the dispensary, when you are on a webinar, or you're doing whatever, ask the questions. There's no stupid questions, but just ask, because again, you're going to be asking the same questions as maybe someone else too. So, and the last part is, don't be afraid to try different products. Again, cannabis industry is still moving and growing, and there's always new products. There's always new strains. There's always new batches that come out with things. And it's good that you're able to open up again, collecting those data points, opening up your repertoire of products is going to be helpful in the long run. So, but I'll open it up for Q&A. I think that's what I have for you today is just kind of being patient, being open.
I love this. And I agree with all of these points. And I love especially, the be patient, be educated. With be patient, especially, there's a lot of people that come into cannabis and they've heard so many things about doing like miracles for other people. And they just assume the first thing that they choose is going to work really well for them. And if it doesn't work, they just completely kind of like turn away from cannabis into different things. And so really being patient, all the different delivery methods that you've explained work differently. So, if a vape isn't for you, then there's tinctures, and there's also like topicals that are more mild. So definitely, give it a couple times to try different things. I like always suggesting to people to try like the smaller size things. Many products nowadays, or brands nowadays, have like trial sizes, smaller, sizes. So you could actually try and see if this is a delivery method that works for you. So these are all really good suggestions to help people figure out their cannabis journey and what works best for them. Do you have time for a couple questions?
Yeah. Yep. I have plenty of time.
Great. First, I also want to ask you too about Control LTD, and that you guys actually have some things that you guys are working on to help with dosing as well. Do you want to mention those, and like people can maybe check out your website?
Yeah. If they, I'll type it in the chat. Control.
Because that's how I actually found you guys, and you guys make something which is really, really cool, and I think so helpful. You guys make devices that actually help people control their doses, right?
Yeah. So we have. Thanks for mentioning that. We have right now we're rolling out with RSO syringes. So basically, it's an RSO, the RSO syringe that you would typically see in the market, but we actually made an RSO kit or an FSO kit to attach onto the syringe. Basically, it makes a lot easier to dose. So with RSO, the oils coming through those, when you push it, it's thick and viscous. It's hard to dose. So we created a product that will allow you to incrementally dose RSO out of the syringe. We have it also has a warming clip on it that you can actually warm the RSO as well before you dispense it. And then the other aspect that we like to kind of mention with control is we realize that standardization especially with recommendations for RSO is kind of everywhere. The quarter, a half grain size and a full grain size recommendations when they divvy out the RSO, it's kind of like up in the air. So no one ever knows what a half grain size should look like or what a full grain size device should look like. So what we are recommending is, let's all agree on, a half of a grain size to be a specific volume. For us, it's 0.025 mLs. Full grain size would be 0.05 mLs. If we can kind of set that guide and that standard so that when people do recommend, a half grain, they'll be like, well, what's a half grain? Well, a half grain is 0.025 mLs. With our device, you can actually divvy it out at 0.025 mLs, or you can do the half grain, which is 0.05. So, that's our biggest thing is let's standardize what we can and be able to, again, journal that, be able to figure out, titrate your RSO dosing just like you would with, tinctures or the capsules and tablets.
Excellent. And then just for the viewers who are maybe new, because we didn't really talk too much about RSO, can you just tell them the difference between RSO and a tincture?
Yeah. So RSO is a lot more concentrated. It's originally Rick Simpson came up with the extraction method. He originally used alcohol to extract it, and with doing that, he created like a super concentrated oil, THC, CBD, full spectrum oil out of it. And in doing so, with it being so concentrated and being dispensed out of a syringe, it's a little bit more difficult to dispense. With a tincture, again, it's less potent. You're going to see it's going to be mixed in. The formulation is going to be mixed in, whether it's like alcohol-based or oil-based, and a little bit lower potency. So it's going to be dispensed a little bit differently and with a different potency.
Great. Thank you for that clarification, because I know some people might be thinking. So moving on to the viewer questions here. Somebody's asking, when we were talking about the tinctures early, are we talking about a CBD tincture or full spectrum tincture? And I guess you can add to this, but the answer would be, it depends. And there's different kinds of tinctures. You can get tinctures that are CBD only. You can get tinctures that are THC dominant. You can also get tinctures that are ratio. So with like a novice person, what would you suggest that they start with a tincture?
So for a novice person, again, if you aren't comfortable with THC, people like to start with CBD. The issue that I find with CBD is it's with some of the companies in different states and all over, it's hard to find a good CBD product that's consistent, especially when they're not under the same testing scrutiny as you would see with like medical cannabis products that have THC in it. So there are, and I do recommend there are products out there that have a small amount of THC and have a higher amount of CBD. So that's a good start as well if you're not comfortable with a higher amount of THC. So any of those would work. What I would recommend in the beginning is that 1-to-1, the same amount of THC as you would have with CBD if you can find that. Those 1-to-1 mixtures are really good to start off with because you're pretty much like right in the middle. It gives you that entourage effect of both of the THC and CBD. So at least if you use that, if it doesn't work, you can always try maybe a higher THC content or a higher CBD content and see where you go. So it's almost like you start in the middle and you can kind of branch off into other things.
Yeah, very good answer. Can you also talk a little bit about tolerance? and how after cannabis consumers are using for a little bit time, how their tolerance might change and how they might have to just increase their dose because of that fact alone.
Yeah, good point. Yeah, tolerance is a big issue, especially with cannabis. And obviously the more you use, the more tolerance you're going to build up to cannabis, and you'll eventually have to increase your dose after a while. But the important part is that when you do find your dose range, you do find you do journal, you're going to be able to better dose at the correct dose versus taking more than you need, and then as you take more than if you take more than you need a lot, it'll end up building up your tolerance level. So you have to end up using more in the long run. So if you can find that range and you can effectively say, okay, at this range, I'm good. It'll help me with my pain. I don't need any more. So the more accurate you are with that, the less tolerance buildup you'll eventually get. Not to say that it's going to go away. You can still build it up at those doses, but it's good to kind of stay where you feel that you're going to need it and not too much more. That'll help with tolerance, but there's no way around it.
I've also found that with tolerance, it also means that some of the unwanted side effects are lessened. So, for instance, like I had to stop smoking for like almost 2 years when I had a child. When I started using cannabis again, like I had no tolerance, and it made me so hungry, so tired. When I would use high doses of THC, I would kind of get that anxiety feeling that people kind of like talk about. And as I kind of my tolerance, like built up, then I was able to use cannabis to treat my medical conditions, and I didn't get as tired, I didn't get as hungry, and I didn't get the anxiety anymore. So it also means that the side effects go away, which is similar to like prescription medicines, right?
Yeah, your body eventually gets used to it. And a lot of those
Yeah.
things, you're right. That's a good point. A lot of those things your body kind of builds that tolerance to. So, same with the dose, your body builds up tolerance to the side effects as well. So.
Yeah. And you can also, if you're worried about tolerance, people sometimes take like a tolerance break, and they'll like stop using cannabis for a couple days. With some conditions, like medical conditions, you may not be able to do that, but for some you can. So if you feel like, you're having to creep up your dose too often, to get the effect that you need, you can always take a break. You can always try and switch around products and find like a different product that maybe has a different cannabinoid profile, might hit you a little bit differently. So those are some things also that I've kind of experienced.
Yeah, those are all good. I like those points. I do find that changing up the strain, changing up the cannabinoid profile does really help with tolerance. And Annie had a good question there. Changing strains, changing it up is definitely a good thing, especially when you want to keep it, keep that tolerance down.
Yeah, sometimes when I buy an ounce, I'll buy like an ounce, but it'll be like an eighth of 8 different things, so I can kind of move around, and change it up. And I find that that's really helpful too when you're using cannabis for long periods of time to treat like a persistent medical condition. So another question, someone's saying that they grow their own medicine. So, how can they know how much they should dose and how much, and how do they know how much is in it? So, the question I guess is like testing. There are some states that have, testing that's available for consumers and for home growers. But I guess assuming that they don't have that testing, how could you say that people could kind of, figure out their own dose when they're making their own cannabis products?
That's a good question. As far as testing, I don't know. In PA, I think one of my buddies, Alex, he works at testing. He'd be able to tell me. But in PA, I don't know if you would not know, but you could not be able to send it because it's illegal to grow your own. But in other states, they might. So I don't know about that. But as far as testing your own medicine that you make, it's going to be kind of the same, right? So you're going to start off at a lower dose and kind of take it, journal it, see how it is, and then slowly build up. So again, you don't want to start like really high and say, start at the top. It's just about that titration and building it up.
Yeah, and you can go online and you can find out recipes on how to make your own RSO, your own tinctures, your own topicals, if you grow your own cannabis. And then it would just be like more trial and error, like you said, kind of like using it by volume. Like when I take this much of it, how much is it, how does it affect me? Is it a strong enough dose? creep that up a little bit more? Does that hit the sweet spot? So it is a little bit more trial and error. And there are some states that do allow consumers to actually have their own cannabis tested. In the state of California, they do allow for that. But I actually don't know of too many people that are actually participating in it because it can actually be kind of costly. And each test is like an additional fee. So, you might just find out the strength, but there's other tests that you can pay for that would be like what cannabinoids are, in it. And then also like for pesticides and anything like that as well, you could also add on and test, but those get more expensive. So, okay. And then last question, somebody's asking about side effects. And they're asking, if you've had too much cannabis, and they've heard that vitamin C can counter affect the effects of cannabis. Have you heard that? Or do you know of any other things that you can do that can help counter affect the negative side effects of cannabis?
I haven't heard of vitamin C. I don't know if you have or not. I did hear of rolling peppercorn around your mouth. A lot of people recommend that to counteract the high. For some people it works, some people it doesn't. But I don't know of anything else that would be like vitamin C or something like that. I'd have to look that up.
Yeah, and I've heard people saying CBD, if you take some just straight CBD, it can help bring down the psychoactivity anyways. It'll help moderate that side effect. There's also an over-the-counter kind of thing that you can buy at head shops and stuff called Undo. I don't know if you guys have ever heard of that. But suppose if you take this Undo product, then it actually can like bring someone down from being too high. And then, the classic, I think like hydrate them, give them coffee, feed them, and then like just try to distract their mind. And then sometimes, just go with it, just learn to embrace it, and just take a nap. One of the nice things about cannabis is that, although you may feel uncomfortable, there's no way that you could ever die. Right, doctor?
Yes, it's true. So it's never happened to anyone that, they were just like, oh my gosh, they died because they took too much. So I forget what the amount that they would have to ingest to actually like possibly die. It's some ridiculous amount.
Yeah, it's impossible almost. And then we had one last question come in, and they're asking, and I've never heard this before. Maybe you have. Do you have any opinion on a T-check tester? Do you know what that means? Have you heard of that?
No, that's new to me as well. So
okay.
I've never heard of T-check.
Yeah, well, we can actually look into that, though. That seems really interesting. I'll have to look into that. But this has been really great. Thank you so much for sharing all of your knowledge with our audience, bringing it back to basics. We've had a lot of different webinars and different subjects, but this is like, I think, one of the most important ones because, if we really can't get people past this hurdle of figuring out what's best for them, they're not going to be cannabis consumers. They're not going to find out how to use cannabis to benefit them. So this has been really helpful information. Thank you so much.
Yeah, thanks for having me. I always enjoy and appreciate being here. And like I said, being amongst the great panel that you have on before.
Thank you. And thank you to your whole team at Control Ltd. I love what you guys are doing and how you're really trying to help figure out and solve some of these issues that people have, to make cannabis more accessible and reliable for people. So this has been really helpful. I thank you. So I hope that everybody here that we were able to share some information that will help you become better informed cannabis consumers, and that the information that we've shared will help you find relief. Until next time, everyone be safe and be well. Thank you.
Thanks.